Welcome back, everybody. Connecticut's new recreational pot law takes effect in just 4 days now, coming up on July 1st. So what does it really mean? Here are the top 3 things you should know right now. It is only legal for adults, so you have to be 21 or older to buy and smoke it or take it, whatever you're going to do with it. Pot sales are expected to start next fall in 2022. Taxes from the sale of pot are expected to bring in $10 million the first year and could bring in as much as $75 million over the next 5 years.
So what will these new pot laws mean for anyone with a medical marijuana license? Are there any protections for those patients? Channel 3 Eyewitness News reporter Mike Savino took those questions to the experts. He is live from the answer desk. And Mike, what are you learning?
Well, Aaron, our medical marijuana program started here in 2012, and now roughly 50 conditions qualify for a medical marijuana card. So what's being done to make sure that those patients continue to have access to the drug?
We want to make sure supply remains available for the medical patients.
For more than 50,000 people in Connecticut, nothing changes on July 1st when possession of marijuana becomes legal. That's because they already have medical marijuana cards. Officials want to make sure that those patients still have the same access to pot, even as Connecticut builds a marketplace for anyone over the age of 21 to buy it.
Protect against supply shortages, make sure patients have access, don't end up in long lines or not having their products available.
But how will that happen? For starters, supply of medical marijuana will be a priority. Consumer Protection Commissioner Michelle Siegel says any medicinal growers, suppliers, and retailers who want to get into the recreational market will need to show how they aren't taking supply from medicinal users. They are also not allowed to move to find more recreational users.
It does give the commissioner that authority to make those changes kind of on the fly.
Lawmakers also gave the Department of Consumer Protection the ability to fix problems, including the power to limit recreational sales in order to ensure medical patients' needs are met. And medical users can start growing their own plants in October, roughly 2 years before anyone else. Should patients continue to pay the yearly $100 fee for a medical card?
That means you're, working with your doctor. The product itself is going to be given to you, dispensed to you by a pharmacist.
Siegel says that's a personal choice, but she gives a few reasons why patients should. First, it means a doctor and a pharmacist are involved. Second, the medicinal market can have advantages for patients. It may feature products not available to recreational users and with higher THC levels. And third, Siegel says having a license ensures patients get priority when it comes to supply.
We're not going to have you in those sort of categories of people who need to be protected.
Now, Siegel also wasn't sure how retail sale will impact the decision to add more conditions in the future to the medical marijuana program. She says it's possible patients will be able to get their conditions added because they can say how marijuana has helped them. Now, if you have a question about something, use the Channel 3 app and loop us in so that we can get working getting you the answers. Live from the answer desk, Mike Savino, Channel 3 Eyewitness News.